Hey guys, more updates from New York. This is actually my final shift here in Brooklyn. So I'm going to be heading back to San Diego later this week. I just wanted to share, some final experiences and thoughts with you guys. I'm posting these videos, because I believe in transparency and the right of the public to know. And especially during this pandemic, the public doesn't really know what's going on inside the hospital or what patients are experiencing who get the virus really badly. So I just want to share, as much as I can so that you guys are, aware of what's going on, because I know it can be hard to know what information to trust, especially when there's conflicting information. And then, when it's worse in some areas, New York and New Jersey and others, and not as bad in other places. And then it's hard when leadership says different things, as well. So it was a pretty rough shift, this last shift, not gonna lie. My two patients did not make it. And the hardest part, and I've talked to my colleagues and fellow doctors and nurses, one of the hardest parts is having to deal with a patient passing, but their family members cannot be there in their final moments. And that's one of the reasons why I came out to New York, to sort of be with patients in their final moments, because I knew that family members aren't allowed, and I didn't want patients dying alone. So in that respect, I feel like I came what I set out to do. But with that said, it was extremely difficult to be with these patients when their family members couldn't be there in their final moments. It was something that will stay with me forever, and it was, very, very difficult. So I just kind of wanted to share that aspect of it with you guys. Even if you don't have the virus, but you need to go to the hospital for some other reason, just keep in mind that they're not able to let family members in because they don't want, they want to limit exposure, and that sort of thing. So that's something that we haven't really had to deal with yet as healthcare professionals. And then certainly family members are not used to that as well. They're used to being there with their loved ones, if they can possibly be there. So that's a whole nother new aspect that nobody's really used to dealing with, and it's very difficult. We've had family members just start bawling on the FaceTime video, screaming, yelling. It's very emotional. It's extremely emotional, and that's really, really hard to deal with. So that's kind of what I dealt with throughout my shift today. We withdrew care from some patients, and the family members weren't allowed to be there. So I went from patient to patient and held their hands in their last moment, and it was pretty emotional. So that's just extremely hard to deal with when family members are not allowed in the rooms, and can't say goodbye to their loved ones in person. So I know it's hard for you guys, especially with states kind of reopening and stuff like that. So I just wanted to kind of reach out to the public, just to be mindful, to keep in mind of what we do know. So right now we don't have a treatment for this virus. We don't have a cure. We can treat the symptoms, but we do not have a cure for this. Okay, so that's number one. That's a fact. The other fact is we don't have a vaccine. We don't have herd immunity. There are certain things that we do know. So we just have to keep that in mind, and just be mindful as things are opening up more. Please just try and be mindful of that. Keep the distance as much as you can. Limit going out as much as you can, and keep washing your hands. Just good hygiene. In general, things like that will really help. And then another thing that we've kind of been noticing is the fear to go to the hospital, obviously, because of everything that the public is hearing. So several patients have waited until just it was too late to come into the hospital. And so we don't want that either. You know, if you are having shortness of breath and if you have had a fever that you cannot that you cannot control with medication, things like that, then you need to come into the hospital. Please don't wait until it's too late. We're kind of seeing that, and I don't know if it's just because of the fear in New York or if other states are kind of experiencing that too. So that's kind of another reason why we were saying flatten the curve. And sort of keep the hospitals open for those patients that really need it. And so if you're one of those patients that really need it, if you are having shortness of breath and you cannot breathe, then you absolutely need to come in, you know. And again, if you're having a fever that's lasting days on end and you're not able to get it to come down with Tylenol or whatnot, then that's another reason for you to come in. So please don't wait until the last second, because that makes it extremely hard for your body to fight off the virus. So that's kind of another thing we've been seeing. Other than that, it's just, I don't know, we don't know how long this is going to go on. And so, you know, healthcare professionals don't have the answers. And I think a lot of people are kind of thinking that we do. And, you know, it's awesome to be called a hero and all that. And, you know, we're lifesavers and all that. And we do the best we can. We try and save as many people as we can. But in this situation with this virus, with COVID, we can't save everyone. We're not saving many as far as when there's an overfilled capacity in the hospital. That's another reason why we're not able to provide optimal, safe care. We're doing the best we can. But then just the bottom line is we don't have a treatment. We don't have we don't know how to specifically treat COVID yet. We'll get there one day. So just kind of keep that in mind and be mindful when you're going out in the public. And as states starts to reopen and you know, everyone starts to come out more, just kind of keep that in mind. Certainly we can't be, you know, afraid to death to step out, but we have to live in reality, and we have to be real and just use common sense, you know. And then again, if you are having symptoms, please don't go out in public. And then if these symptoms are not improving and they're getting worse, then come into the hospital so that we can treat you. The sooner the better, you know, we can treat the symptoms. So it's, you know, it's still pretty crazy in New York. So don't forget about all the healthcare professionals that have to stay here, that live here. My hats go off to them. You know, I'm going back to my part-time job as a hospice nurse in San Diego. Very different than being in the ICU, intensive care unit. So these full-time staff members will be out here, you know, till this ends, and we don't know when it's going to end, and it may not ever end. We hope it gets better, and we hope we can find a cure and a treatment or a vaccine, but it's going to be a long time. It's going to be months, if not years. So please keep that in mind, and that will help with, you know, preventing surges from coming to other states. So just please be mindful of that. And then, you know, just kind of go if you could go back to the previous videos that I posted about having those discussions with family members of what their wishes are, and think about what your wishes are, regardless of if a crisis is going on. It's just important, you know, hands down, no matter what. So that will certainly help, because again, I don't know, you know, family members aren't allowed in the hospital now because of COVID, and then I don't know when they'll let up on that. If you know, I don't know if it's going to forever change visitation rules, just because we don't know and we don't want more exposure. So that's, like I said, we're not used to that. Healthcare professionals are not used to that. Patients are not used to that. Family members are not used to that. This is a whole sort of new thing, a different ball game for everyone involved, sort of limiting patient and family member contact. And I don't know when that's gonna change or let up. So that's just something that we all have to keep in mind, and how we're gonna deal with that, and and how we're gonna move forward with that. So anyway, guys, I just kind of wanted to kind of give you some more updates. I hope that was helpful as far as what's really going on. We are still losing patients. Patients are really sick when you get the virus badly. I know that there are cases, mild cases, and that's awesome, but there are still deadly cases, and it is pretty bad. So just, you know, keep that in mind. That's the reality. I know we all kind of want to think about just going back to normal or reopening everything, and we have to move forward. We do have to open things slowly, but we don't have a cure for this virus, so people are going to keep dying until we find a cure and a vaccine and all of that stuff. So just kind of be real, keep that in mind, live in reality, but also kind of be hopeful. And do the best we can, and not live in fear. It's kind of a balance. It's difficult. I get it, but it's something that we kind of have to do. This is where we're at right now. So just kind of keep that in mind when you go out, and, you know, kind of reconsider, do I really need to go out? Do I really need this right now? Or maybe I can wait and go run this errand when I have to run this really important errand, you know, stuff like that. And then, of course, just washing hands, wearing masks, and keeping social distance. It's gonna help. I know it doesn't seem like, you know, it might be helping, and it's kind of annoying, and it's an inconvenience, but, you know, firsthand experience, we do not want a surge. We cannot handle a surge with our current healthcare system. I mean, we can't. We're trying the best to be prepared. Other states have protocols in place and are prepared for what they think a surge will look like at their hospital, but we haven't had to deal with many surges, if any. I know I haven't, and a lot of my colleagues have not ever had to deal with a surge. So you don't really know how you're going to be able to handle it until it hits you. So that's why it's important to kind of watch other states, watch other hospitals, watch what's going on, talk to people who are dealing with it, you know, firsthand, because again, it's hard. We're getting a lot of conflicting information with different sources, but you have to kind of think about where are these sources coming from? Can I trust them? And then, of course, leadership is giving different perspectives, and, you know, so it's very important to be real, look at the reality, and talk to those that are actually dealing with it, and are having firsthand experience, because that's how we're going to learn, right? That's how we're going to improve. So I'm hopeful that other states and other hospitals have kind of been watching what New York and New Jersey are going through, and I hope my videos have been helpful as far as, you know, kind of that. And then I've been very vocal in talking to several news stations back in San Diego have interviewed me, so keep on the lookout for those. I'll share them when they come out. I'm very vocal at school, University of San Diego, and I've been interviewed several times with them and their media connections. So I'm speaking out as much as I can as far as my firsthand experience being a nurse, dealing with these patients. What am I seeing? What kind of blood work am I seeing? What kind of symptoms am I seeing? What's the clinical presentation? What do these patients actually look like? You know, because it's hard, because only us healthcare professionals who see them and treat them know, because we're the only ones that are allowed in the hospital, right? So the public doesn't really know, what does a patient look like who gets COVID? They kind of just hear. And so reach out to us, reach out to healthcare professionals that you know that are at the bedside, and if you're curious and you want to know, or if you are in healthcare but you're a little bit far removed and you're on the clinic side, or you're thinking about maybe going back to bedside, you know, stuff like that. You know, just reach out. We all kind of have to try and learn and improve from this situation and this crisis, so that we can be better prepared when and if it hits close to home. And also, you know, we never know when another pandemic, God forbid, might come, you know, so how are we going to be prepared? Are we going to learn from our mistakes, or are we going to be able to learn from, you know, what could we do better in this situation? Those kinds of things. So that's another reason why I'm posting these videos, just to kind of document what I'm seeing and what I'm experiencing. So anyway, I hope that was helpful. Please just be mindful of your surroundings and of others around you, and you know, stay home if you can, and those kinds of things. So reach out to me if you have any questions. Definitely happy to answer anything, and Anyway, guys, stay safe, and I'll talk to you guys later. Thanks. Bye.